After a tooth is lost and healing occurs, an implant can be used to replace the missing tooth. An incision is made in the gums, and the gums are reflected away from the bone. A hole equal to the size of the implant is then drilled into the bone, and the implant is then threaded into the bone. A healing cap is then screwed into place, and the gums are repositioned around the healing cap and sutured into place. The healing cap serves as a guide for the gum tissue to mold itself around so that they will fit tightly against the eventual crown. The implant is then allowed to heal undisturbed for about 3 to 4 months. The patient then returns for the second visit to take the impression for making the crown at the dental laboratory. At this second visit, the healing cap is removed and the smooth adaptation of the gum tissue is noted. An analog abutment is then screwed into the implant and attached with a threaded screw. The hole is then sealed with temporary cement. An impression is then made of this analog abutment, as this is what the dental laboratory will fabricate the new crown on. The impression tray is seated over the analog abutment and the teeth and allowed to set. The impression is then removed and sent to the dental laboratory. Before the patient is dismissed, the analog abutment is removed and the healing cap is put back into place. About 2 weeks following the second visit, the patient returns to have the new crown permanently seated. The healing cap is once again removed for the final time, and the actual abutment now is seated into the implant and secured with a screw. It is first hand tightened, and then a torque wrench applies the final tightening to the screw. Cement is then used to fill the hole on the abutment. The crown is tried in and any adjustments are made. Cement is then applied to the inside of the crown, and the crown is then seated permanently into position.